Hello everyone, I'm Dr. Gautam Kugati. Welcome to Neurosurgery and Beyond. Today let us discuss on the topic why surgeons do not want to operate on an elective case during the pandemic outbreak. So let's discuss what is an elective case. An elective surgery is a non-emergency surgery which can be easily staggered and can be done after a few weeks or months depending upon the convenience of the surgeon and also the patient. An elective surgery is a non-emergency surgery which can be easily staggered and can be done after a few weeks or months depending upon the convenience of the surgeon and also the patient. To say, for example, a knee transplant surgery, a slip disc surgery, or a hernia repair, and most of the times a lump in the breast, and there are many other such elective surgeries which can be done after a few weeks or months. Let's take a scenario wherein a patient who was operated during the pandemic and it was an elective surgery, and she turns out to be an asymptomatic carrier. That means she is carrying the virus, but she herself has not become symptomatic for the disease. So a similar case in Wuhan, a asymptomatic carrier was operated, and she happened to transmit the disease to 14 other healthcare workers, and they all got infected with COVID-19. The effects of operating such patients during the pandemic can be discussed under three subheadings. That is the risk during the operation in the operation theatre, secondly in the ward, thirdly planning the pandemic. So discussing the one in the operation theatre, when the patient is being intubated, the anesthesiologist will be at the highest risk of getting infected because of the aerosols which come out of the patient's mouth and the breath. So, and also the aerosols, that is the droplets and the particles which stay in the air, which can remain for many days, up to many a times up to 3 days, that is 72 hours as well, on the surfaces of the wall and also the metals in the operation theatre. And after this surgery, if the next patient is taken within that time frame, so we can, since it is a closed environment, the operation theatre, the aerosols can be blown up to the next patient which is being operated, and he or she also can get infected. Thirdly, the blood contaminants can always be a threat for transmission to the surgeon and also the other supportive staff. So the second thing which we are discussing is in the ward. So when this patient is utilizing the services in the ward, mainly by touching the cot and also using the toilet seat and other things, then there is risk of transmission of virus to the other patients in the hospital ward as well, and also the staff who are at risk when the patient is being given medicines or collecting the blood samples and other situations as well. So thirdly, while planning for the pandemic, so we need to flatten the curve. When the elective patients are being treated in the hospital, they utilize the hospital resources, namely the ICU beds, the ventilators, and also the cots, the beds. So when all these patients are being utilizing the resources of the hospital, if the curve goes beyond the supply of the resources, then we are not able to cater for the needs of the emergency patients who are being affected by COVID-19. So that means a patient who could have been treated in the hospital who is having COVID-19, that particular bed and ventilator is being used by an elective case, and I would say that is criminal. So this point also we need to keep in mind when operating the electives. So this is also a reason why the surgeons do not operate elective surgeries during a pandemic. At the same time, tomorrow a kid comes up to me and asks, "Doctor, my mother died because of cross transmission of this virus COVID-19 during her elective surgery. And if it were to be an elective surgery and we could have postponed, then why did you had to operate on her? So if this question comes up, we will not have an answer if we keep operating elective surgeries during a pandemic.